Hi, welcome to my presentation on imipramine hydrochloride. My student ID is u3260366. First of all, introduction. Imipramine belongs to a group of medicines called tricyclic antidepressants. Imipramine is a drug indicated for the treatment of depression. It is also indicated to treat nocturnal enuresis, bedwetting in children. Next is the dose and mechanism of action. The dose of imipramine starts at one 25 mg tablet up to 3 times daily. The dose of the medication will be adjusted based on the response to the treatment. It acts by preventing the reuptake of neurotransmitters serotonin and norepinephrine. Lack of norepinephrine and serotonin activation of the postsynaptic neuron has been associated with depression. The concentration of these neurotransmitters in the synaptic cleft rises when the reuptake of these molecules is slowed. Along with reducing depressive symptoms, this regulation of neurotransmission causes a wide range of changes in the structure and function of the brain. Next is the pharmacokinetics. Here we have absorption, distribution, metabolism, and excretion. So in absorption, the drug is absorbed about 95% after oral administration and reaches systemic circulation. Due to the substantial inter-individual variability, the bioavailability of the drug ranges from 29 to 77%. Moreover, normal peak plasma concentration occurs 2 to 6 hours after oral treatment. The presence of food does not affect the absorption. In distribution, imipramine shows 60 to 96% protein binding with lipoproteins, albumin, and 1-acid glycoprotein. The drug's apparent volume of distribution is considerable, ranging from 10 to 20 liters per kg. The medication builds up in the brain at concentrations 30 to 40 times higher than in the bloodstream. And in metabolism, imipramine primarily metabolizes in the liver. And in the end excretion, it is excreted in urine with around 5% of the drug as the parent compound. Next we have side effects. So it includes dry mouth, constipation, hot flushes, double vision, dilation of pupils, changes in blood pressure, irregular heartbeats, loss of appetite, hair loss, ringing in the ears, and liver damage. The sudden discontinuation of imipramine can lead to withdrawal symptoms such as nervousness, anxiety, headache, and irritability. Next, we have some contraindications, which includes hypersensitivity. And during the acute recovery phase of myocardial infarction, concurrent administration with an MAOI or use within 14 days of discontinuing an MAOI, monoamine oxidase inhibitor. Some legal, clinical, and ethical considerations. Imipramine hydrochloride is classified as a prescription-only medication and is listed in Schedule 4 of SUSMP. This means that it can only be legally obtained with a valid prescription from a licensed healthcare professional. Prescribing medications for off-label use involves legal and ethical considerations, and healthcare providers must exercise caution and informed judgment when doing so. Healthcare providers have an ethical obligation to ensure that patients or their legal guardians are adequately informed about the risks and benefits of imipramine treatment. Informed consent is essential to respect patient autonomy and decision making. We have warnings like suicidal ideation in the early phase of the recovery, and in pregnancy and lactation, the treatment is avoided because imipramine is excreted in breast milk. Also, the serotonin syndrome, it includes some symptoms like gastrointestinal issues, neuromuscular abnormalities, changes in mental status, and autonomic instability. At the end, test your knowledge. Thank you for listening my presentation.